Let's talk about how doctors treat type 2 diabetes and where Gliclazide MR fits in today's medical world. Gliclazide MR is a very cheap drug. Doctors often try to control blood sugar early with metformin, plus changes to daily habits. But if that doesn't work, they look at other medicines. For over 60 years, a group of drugs called sulfonylureas has helped many people control their diabetes. These medicines work by making the pancreas release more insulin. They help people who no longer control their sugar well with just metformin. Number 1. Gliclazide MR. Works well, costs less, and is reasonably safer. Some sulfonylureas are new, and some are old. The newer ones, like older sulfonylureas, can cause more low blood sugar episodes. New ones are preferred because they have fewer risks and don't seem to harm the heart. Gliclazide, especially in its modified release form, stands out because it works all day with one dose. People take a lower amount of this medicine and still get good control over sugar. It also comes in a tablet that can be split, making it easier to adjust for each person, which helps people remember to take their medicine. Number 2. Gliclazide MR is comparably effective. It lowers sugar levels just as well as metformin and some newer drugs. The numbers from research are promising. In one large research project, the EasyDIA research, 7,000 people saw their average sugar markers, HbA1c, drop between 1.6 to 1.98%, depending on whether they started at first or after another medicine. Most people, about 65%, met their sugar target after a few months. But what makes Gliclazide MR different is that people hardly get low blood sugar or hypoglycemia. In that same research, only about 0.04% had this problem. The rate of weight gain is also lower than some other medicines in the same family. Number 3. Gliclazide MR doesn't just work on sugar levels. It helps protect the body against stress caused by high sugar. It works as an antioxidant, which means it helps clean up harmful chemicals in the blood. Gliclazide MR's chemical structure means it helps keep blood vessels working well and may help avoid problems in the kidneys and eyes. Research shows that people taking Gliclazide MR for longer have better sugar control over time. The rate at which the medicine stops working is lower. About 7% of people over 5 years had what doctors call secondary failure, which is much less than other similar medicines. Number 4. People who have kidney problems can often use Gliclazide MR. This is good news because many diabetes medications have to be stopped when the kidneys don't work as well. When researchers looked at people who added Gliclazide MR to insulin therapy, they found even better sugar control. The mix helped drop HbA1c by more than 1%, which is a strong improvement. Gliclazide MR got its start because scientists more than 80 years ago discovered certain chemicals could lower sugar in the blood. The medicine works by sticking to certain spots on pancreatic cells, called receptors, which trigger the release of insulin. But it mainly sticks to receptors in the pancreas and not in the heart or blood vessels, which lowers the risk of harming the heart during times when the blood supply is cut off, a problem called ischemia. Doctors get worried that many sulfonylureas can increase heart problems, but Gliclazide MR mostly avoids these risks. Big research projects with thousands of people show that using Gliclazide MR in an intensive way can cut the risk of small blood vessel damage by about 14% and kidney damage by 21%. When compared to older drugs, people on Gliclazide MR had fewer deaths and less heart trouble. Number 5. In other comparisons, Gliclazide MR was almost as good as modern drugs called DPP-4 inhibitors, but usually cost less and is easier to take. Sitagliptin is one such drug. People on Gliclazide reached their sugar goals about 35% faster in research, but both medicines helped over the long term. In a big survey across Asia, almost half the people using sulfonylureas were taking Gliclazide. People using it reported safer results, with fewer episodes of low sugar and better overall control. This is important, because diabetes is rising all over the world. Doctors used to worry about sulfonylureas causing people to gain weight or have heart dangers, but it looks like Gliclazide MR avoids most of these problems. Its design means it doesn't trigger insulin release in a way that leads to dangerous lows or affects heart cells the same as older drugs. Number 6. Some research points out that people who started with good sugar control early and kept it there for the first year after diagnosis had fewer strokes and heart attacks for the next 10 years. Dropping their HbA1c by every 1% led to 37% less damage to small blood vessels, 14% fewer deaths linked to diabetes, and 12% fewer strokes. Research showed the ADVANCE project used Gliclazide in over 90% of their patients. Intensive sugar control with Gliclazide MR led to lower average HbA1c after 5 years, from 7.3% down to 6.5%, and maintained the target for 80% of patients. Compared to other sulfonylureas, Gliclazide MR generally had fewer reports of hypoglycemia or low sugar events, better sugar control, and improved heart safety. A look at deaths in people taking various sulfonylureas over 3 years showed Gliclazide MR had one of the lowest rates of death, while similar drugs had higher rates. People with kidney problems, older adults, and those fasting for religious reasons, like Ramadan, can use Gliclazide more safely. That makes it versatile for day-to-day medical care. Some data suggested that for every year people took Gliclazide, Mr. they were more likely to keep good sugar levels with less risk, compared to those who used older drugs. In fact, for those who had to switch to insulin, it took about 8 years on Gliclazide MR before needing insulin, which is longer than with some other drugs. But not all research says Gliclazide MR is better than everything else. Modern drugs called DPP-4 inhibitors may lower sugar a little better and help people lose more weight. Still, Gliclazide, Mr. matches them for safety and is much less expensive. Gliclazide MR is different from other sulfonylureas because it does not stick to receptors in the heart and blood vessels, so it doesn't affect the heart's ability to adapt to low blood flow, which is important if someone has a heart attack. Research looking at deaths after a heart attack found that people using Gliclazide, Mr. had lower death rates. In another large research project, Gliclazide, Mr. was linked to a 33% lower total death rate and a 29% lower chance of dying from heart disease compared to older drugs. When compared to modern combinations of medications, people starting Gliclazide MR did not have higher rates of heart problems or deaths. In more comparisons, researchers tested sulfonylureas as add-ons to metformin. Results showed they did not cause higher rates of death or heart problems. In some cases, doctors tested if low blood sugar was more common in people using sulfonylureas. The numbers were higher compared to modern medicines, but when they checked just Gliclazide MR, it seemed to be much safer. Researchers also tested people using combinations of Gliclazide MR and insulin. Results showed better sugar control but with similar rates of low sugar episodes. But some research suggested the risk of heart rhythm problems, called arrhythmias, may be a little higher for the whole group of sulfonylureas compared to other diabetes medicine. For Gliclazide MR, it was not clear if this is a real risk. A review showed Gliclazide MR sometimes had lower risks than glimepiride. Number 7. For people wanting to lose weight, trials showed Gliclazide MR led to less weight gain than older drugs but was not as strong as some modern medicines. People using Gliclazide MR had 0.1 kilogram less weight after 6 months compared to one group that lost 0.4 kilograms. Doctors and experts agree that the real future for Gliclazide MR is as a safe, affordable, and easy-to-use medicine for type 2 diabetes. It's found in lists of essential medicines around the world. Gliclazide MR works by helping your body send out more insulin and protect the cells that produce insulin. It helps lower blood sugar, makes weight control easier, and reduces the chance of dangerous drops in blood sugar. It lowers the risk of kidney damage, helps your heart stay healthy, and is suitable for older adults or those whose kidneys don't work well. But it may not be the very best sugar-lowering medicine in every way. Some newer, pricier medicines can help a little more with sugar and weight loss, but Gliclazide MR matches them for safety and control. Doctors say Gliclazide MR should be chosen more often over older sulfonylureas. This helps people live longer, avoid health issues, and spend less money on medicine. Number 8. Research keeps saying that Gliclazide MR is safer for the heart and kidneys. It is easy to use and has fewer risks of low blood sugar. Many experts now recommend that if someone needs a sulfonylurea, Gliclazide MR is the best choice. It's affordable, does the job, and has fewer side effects. So, if you or someone you know has type 2 diabetes and needs more help controlling blood sugar after metformin, Gliclazide MR may be worth asking about. It works well, does not usually cause low sugar problems, and can even help protect your heart and kidneys. Always speak with a doctor before changing or starting any medicines. This helps make sure you get the best care for your diabetes, day after day.